Skin health is a reflection of overall well-being, but only few know this better than Dr. Rashmi Soni Lohiya. With over 12 years of experience, she has helped over 5,000 patients. Today, we are at Baner Road at Skinsure Clinic to speak with her. Let's learn more about skin health, hair health, anti-aging treatments, and much more from the expert Dr. Rashmi Soni Lohiya. At Skinsure Clinic, the focus is clear: personalized skincare that transforms and revitalizes. Under the expert guidance of Dr. Rashmi Soni Lohiya, the clinic offers a haven of advanced treatments for glowing skin and healthy hair. With over 12 years of experience, Dr. Rashmi Soni Lohiya, qualified with DDV, MD, and DNB, leads the charge in dermatology, trichology, and cosmetology. As the founder of Skinsure Clinic, she brings a wealth of knowledge and compassionate touch to her work. Skinsure Clinic is celebrated for its comprehensive approach to skin and hair health. With over 5,000 patients treated, Dr. Rashmi and her team excel in addressing hair loss and pigmentation issues, offering tailored solutions that restore confidence and radiance. The clinic's expansion into wellness with a state-of-the-art body shaping and fat loss center in 2019 underscores their commitment to holistic health. For unparalleled care and a dedication to your skin and hair well-being, Skinsure Clinic is the ultimate choice. Consult with one of the best dermatologists in Pune to discover the perfect solution for all your skin and hair concerns. Hello and welcome to Pune Times Mirror. I am Anaum Shaikh, and today we are at conversation with renowned dermatologist, cosmetologist and trichologist Dr. Rashmi Soni Lohiya. Hello and welcome, ma'am.
Hi.
So, ma'am, skincare is all the rage on social media and everywhere. So, at Skinsure Clinic, what are the most common problems that you encounter?
So at Skinsure Clinic, we see all kinds of patients, okay, starting from younger age group to older age group. And of course, the most commonest concerns that we come across is like acne, acne scars, pigmentation, melasma, photopigmentation, tanning, anti-aging concerns, hair loss, and so many more. But these are the commonest ones that we come across.
So, ma'am, how do you treat acne scars and pigmentation, since these are the most common ones?
See, acne and acne scars, contrary to popular belief, acne is not just a teenage problem. All right. So people get acne even post 25, 30 years, and which is called as adult acne. And acne is, for so many days we used to think that it is something that people grow out of, which is now changing, because acne can leave behind a lot of consequences like dark marks, scars, which are very difficult to treat. So early treatment for acne is extremely important, whether you are a teenager or whether you are facing it as an adult. Then, along with the rising cases of polycystic ovarian syndrome or other hormonal issues, again acne is on the rise. Another big thing is that acne causes a lot of psychological distress also, especially in teenagers. So it is very important that you seek early treatment for acne to prevent all these things. And of course, so acne, we have different treatments, which oral medication, creams, depending on the severity of acne. Of course, it is a long treatment. So acne cannot be like a fast this thing that you take the medicine and it's done in 15-20 days. Sometimes people need to take treatments for almost 6 months to a year. And then of course after that we have treatments for the scars and the marks, right? Marks and scars are very difficult to treat, and a lot of people feel that they can go away with home remedies and all, which is not the case. You need to do in clinic treatments like maybe a micro needling or a CO2 laser, threads. So all this you need to do, because when the acne heals and it is leaving behind a scar, so the problem which occurs is that there is a breakdown of the collagen under the skin, and because of which the support to that part of the skin is lost, and it gives rise to that puckering or that scar, which is that deep set. So to reverse this entire process, you need to again give it like a new formation of collagen needs to be done, a lot of rejuvenation of collagen, fibroblasts, and for that you do require treatments. No creams or tablets can help you with it. So I always tell my patients that seek early care for acne so that the consequences are much less. And then of course we have treatments for acne scars also. Again, with acne scars, earlier the treatment, the better the results always.
So do teenagers also need treatments as such?
Yes. So acne comes as early as, let's say, 13, even 11, 12 years, those people who are just hitting puberty. So in these young people, in teenagers, we avoid giving a lot of tablets as far as possible. Again, like I said, it depends on the severity of the acne. If the acne is extremely severe, then it has a lot of probability of it leaving behind scars, and then in that case we need to put them on oral medication. And of course, like I said, because it is the puberty which is hit, and the pubertal changes will last up to 19-20 years. The hormonal changes keep on happening, so we require a long term treatment of acne.
Okay.
But in these cases, then what we can do is, when you are not able to give a lot of oral medication, then we rely on other treatments like, let's say, peels or something called as a cryo slush, which can take care of the acne per se without giving a lot of oral medication.
Okay. So, ma'am, also skin diseases such as psoriasis and eczema impact the quality of life of a person, right?
Yes.
Yes. So, what are the treatment for such things?
So, see, one thing that we need to remember is psoriasis or eczema or dry skin or a lot of these conditions, they are not curable.
Okay.
All right, we can help them. We can help control them with medicines, but it's not that. And if anyone is claiming, there are a lot of advertises which are there on the television or anything, claiming that there is a cure for psoriasis or there is a cure for eczema. Please do not fall prey to such ads. So see, basically psoriasis and eczema is more of I would say a disease wherein the skin becomes extremely dry. Okay, there is a problem with skin cycling. So in psoriasis especially, as we all know that your skin is shed every 28 days, the top layer, which is a normal thing. But in psoriasis, that cycle shortens considerably, sometimes up to 4 to 7 days. And that is why you get those scales which are heaped up, dry skin, and all that, right? So, the problem with this is, one, it looks bad. All right. So, patients will always have that psychological. This, when you are going out into a social function or meeting friends, you have that psychological impact that it's looking bad. There is a lot of itching.
Yes.
Right, a lot of times, especially with women, when you're working in the kitchen or working with soap and all that, it just flares. Psoriasis and eczema cases flare with a lot of soap and harsh detergents, and so again it becomes a problem with your daily life, daily routine. And of course, in a similar way, sometimes when those psoriasis can really flare, so then sometimes it can come on the body. Another thing with it is that it can also cause joint pains. In a lot of cases, psoriasis is also associated with joint pains and arthropathies, and also in general, the entire quality of life of the patient is hampered.
Yes.
But again, like I said, there is need for patients to seek treatment from a qualified dermatologist, because there are a lot of ayurvedic treatments and a lot of other treatments which is being prescribed, and allopathic treatment is being criticized, and for some reason people do not opt for it. But the problem is that when you take these alternative treatments, sometimes the psoriasis can really flare very badly. You may land up in the hospital. So it is extremely important that you get early treatment from a well qualified dermatologist. And we have tablets, we have creams, we have very good treatments which are coming up for psoriasis. We have a laser which works in psoriasis wonderfully. We have newer and newer therapies called as biologics, which are very, very, I would say, specific to treat the cells which have, kind of the pathogenesis of psoriasis, which give you very good results without any side effects. All right. So all these things are there. These, when you take an early treatment for psoriasis, it also affects your joint. It will give you relief from joint pains also. So in all, it is very important that you seek early treatment from the right person. Secondly, there are certain things that you can do back home, like keep your skin well moisturized, avoid the use of harsh soaps, detergents, all these things which will dry out your skin further. Learn stress management techniques, because stress and psoriasis there's a well known correlation. Again, we have also recently found out that there is a correlation with diabetes, with obesity, and with psoriasis and a lot of other skin problems. So maintain a healthy lifestyle, maintain a healthy weight, and avoid habits like smoking, alcohol. So all these things are also linked to psoriasis. So this is something that patients can do it back at home to prevent the flare, and like I said, seek early treatment.
So, ma'am, hair loss is another major concern. What are the causes of hair loss and how do you deal?
So see, hair loss is a very, very vast subject. It's very difficult to, so there are a lot of reasons for hair loss. Most of us are not aware. So there are two entities. Okay, there is something called as hair fall, and there is something called as hair thinning. Right? Hair fall is when you're actually losing hair from the roots, and hair thinning is when there is not a lot of hair fall, but there is each strand of hair is thinning. Okay, so there are two different things. Of course, the end result is going to be the same, that more of your scalp is going to show, whether it is hair fall or hair thinning. So there are lots of causes. The commonest being what is called as androgenetic alopecia, or it is also called as patterned hair loss. It is male patterned hair loss or female patterned hair loss. So it is seen more commonly in males because males have naturally a higher level of testosterone as compared to females. So basically, it is this testosterone which plays a role in this hair thinning. So this is the case where you have hair thinning, where in males, if you see, you will find that most males will start going bald, from the temples, and the hairline recedes behind, and the end they're just left with a thin band of hair in at the back of the head. So that is basically androgenetic alopecia or a male pattern baldness. In females, it is not seen very commonly. It is seen after menopause more commonly, because again there are hormonal changes which are happening, or in a female if there is polycystic ovarian syndrome or thyroid or some other hormonal imbalance which has happened, only then you will see a female pattern baldness. In female pattern baldness, you will see that the parting is started widening. In females, very rarely you will find the pattern of temple thinning or the hairline receding. So now this is the most common one. Of course, it has a lot of causes. Like the biggest one is hereditary or genetics. The family history plays a huge role in this, and like I said, hormonal changes. Right. So for this is again, now we don't call it like a disease. It is more like, I would say, a growing. It is a part of your aging. So most men will lose hair, by the time they're 50, 60. And so in this case, we have medicines, oral medicines. We have solutions which are given, to combat this. Again, this is not something which can be treated, as in till the time you're taking medicines, your hair thinning will stop. You will get a new hair growth. But once you stop taking treatment, this slowly is going to reverse, because of course we're not working on the hormones. Right? So that is something which you need to accept, that you will have to be on some treatment lifelong. Okay. Then apart from this, we also have certain therapies which are done in the clinic, like mesotherapy or PRP, which is called as platelet rich plasma, which is injected and which gives you a faster growth of new hair. And of course, at the end of it all, if nothing is working, or if you are losing a large amount of your scalp is showing, then of course then we go in for hair transplant. But a word here, that even after hair transplant, people think that it is done, but it doesn't happen that way. Even after hair transplant, you will need to be on some medication. You will need to continue PRP therapies to maintain the hair growth also. So that is one. Secondly, we have hair fall due to a lot of things, like a lot of parlor treatments, styling, chemical treatments, nutritional deficiencies. In India, it is very common. You have iron deficiency, anemia, thyroid disorders, post pregnancy, post delivery, you get hair loss. So all these are also the causes of hair loss. So when you visit a doctor, it is very important to identify the cause of hair loss, so that you can treat it properly. Especially now, post COVID, also people have presented with a lot of hair loss cases. The hair loss cases have risen. So it is very important that you identify the cause and then you start with the treatment, rather than just blanket people are popping in biotin gummies, or just taking something off the shelf, and it really doesn't help because we don't know what exactly is causing the hair loss.
Rosemary oils and all of that.
Yes, precisely. So it is very important that you diagnose the cause of the hair loss so that you can get the proper treatment.
Yes. Ma'am, you talked a little about PRPs and the other treatments that you offer. So can you please elaborate on that?
So see, basically, like I said, so there is hair thinning with pattern baldness. All right. So when your hair is thinning, what primarily is happening is that in males especially, and in females who have these hormonal issues, the testosterone acts on the hair. There are receptors on the hair. The testosterone acts on that and causes hair thinning. Okay. So we give you medicines which also work on these receptors so that the testosterone does not bind to it and does not cause hair thinning. Then, like I said, we have some solutions. We give a fair trial of all these medicines, all right? And then to get a better scalp coverage, in some cases, the response may not be adequate with just medicines or lotions. Or for a faster hair growth, we do mesotherapy, PRP. Okay, so mesotherapy is basically a cocktail of medicines in which is then injected into your scalp. That is one treatment. PRP is, like the name says, it is a platelet-rich plasma therapy wherein a patient's own blood is removed. About 10 ml of blood is taken. It is centrifuged, and the platelets are separated from the blood, and that platelet-rich concentrate which is there, that is injected back into the scalp. So the principle behind it being that whenever you get any kind of injury in the body, your platelets go there firstly to prevent bleeding, and then the platelets release a lot of growth factors, which causes the injury to heal. The same principle is used here in the hair because the platelets release a lot of growth factors. Those growth factors help with the hair growth, and that is why it gives results. So PRP is also done. Again, it is done on a multiple session basis. And like I said, it cannot be that once you've done, let's say, a fixed number of sessions and you're sorted, you have to continue with maintenance.
So, ma'am, a lot of people want to get anti-aging treatments and all of that. But there are cases where Botox or fillers, they have gone wrong. So could you please tell us a little bit about that?
So anti-aging is a huge rage.
Yes.
And you keep on seeing, you see celebrities are getting it. And in fact, now even common people are opting for it. Right? Earlier, it was just probably the domain of the celebrities. But what has happened is over the year, a lot of advancements that have happened as far as anti-aging is concerned. Right? So initially, I'll tell you about 10 years back or something, the dictum was when we were doing fillers, it was you lose volume at a certain place and you just fill it.
Yes.
That was the dictum. So you lose volume at your these folds and we would just fill it. So over the years, the techniques have changed. There has been a lot of advancements, and we have studied facial aging in detail. And now we know there are a lot of other factors also which is responsible for aging, right? So basically, there is your intrinsic aging, which is happening because your chronological age is increasing. There are extrinsic aging, which is happening because of other factors, environmental factors, mostly the ultraviolet rays, which is the most important cause of accelerated aging. Smoking, stress, lack of sleep, pollution. All right. And another very important part is gravitational pull. All right. So the gravity, like it's acting everywhere, it's acting on your face too. So that is why you get sagging also. So everything, as you're aging, everything comes down. Right. So earlier when you were younger, so we typically call it as the inverted triangle of youth, wherein this is the base and this is your apex of the triangle. When you are aging, the exact opposite happens. The base becomes wider here and the apex comes here because everything is sagging down. So when it comes to aging, there is not just loss of volume, but all these factors are also acting, right? So when we approach a anti-aging case now, there are two things that we need to concentrate on. We need to concentrate on the facial skin, because along with aging, it's not just the volume loss or the sagging. Your skin texture goes is not up to the mark. Your skin tone, you get open pores, you may get pigmentation, you may get age spots. So it is the top layer of the skin which is also undergoing a lot of changes, and which shows your age. You will get fine lines, you will get wrinkles. Along with that, there is a facial shape which is also changing. So when we approach an anti-aging case, we have to look at it like a 360 approach. It cannot just be that a patient comes to me asking for a filler and I just give a filler and that's it. That is why the results are not gratifying, because you're not treating the entire face as one unit, right? That is one thing. Secondly, earlier the trend was of overfilling.
Yes.
Now the trends have changed. People want a more natural look. They want to look their age, but then they don't want to look, filled up. It's more like, we say nowadays, we talk about more than anti-aging, we talk about facial rejuvenation, right? So when we approach a case of anti-aging, like I said, so there are several treatments that you have to do. So one thing I always tell my patients, that again, anti-aging is a journey. It cannot be ki you've done one treatment and it's taken care of everything, right? So it begins right from at-home care to precautions that you need to take to prevent accelerated aging, and then we come to in-clinic treatments. In-clinic treatments also, we focus on rejuvenating the skin and also looking at the facial shape, like wherein there is loss of volume, there is loss of contour, there is sagging, all that. So everything needs to be approached. So earlier, like I said, when it comes to fillers or Botox, so Botox basically works on wrinkles, right? So Botox is typically done for the wrinkles on the forehead, or the crow's feet. But Botox is also done for facial reshaping. So earlier it was just thought that people just did for wrinkles. There are a lot of other uses now that we are using for Botox, like right from rosacea to hyperhidrosis, that is excessive sweating, to facial reshaping, to giving you a better jawline. So even younger people are getting Botox done nowadays. The idea is that Botox needs to be done from an experienced injector, so that it does not give you a mask like faces and does not spoil the shape of your face. That is very important. Secondly, coming to fillers, so like I said earlier, there was just the concept of filling the face wherever you're losing volume, and also the face was filled in the hope to give support toward the lower tissues to lift them up. All right. So we were not taking the concept of gravity in uh, in the focus, and because of which, what was happening was, there was a lot of overfilling of faces trying to compensate for these folds, and that is what you see, those botched filler jobs on Google or whatever. Now when I say we approach it in a different way, we do fillers only for the areas where there is volume loss, like maybe under the eye, or in the temples. That is what we do fillers for. But for the sagging part of it, we will then do other lifting treatments. So in lifting treatments also, we have some non-invasive treatments, and which we have minimally invasive treatments. So anti-aging, basically, we have a huge kitty to choose from. Each person is very different, right? So each person's face is very different. That's why the treatment has to be extremely tailored. Like when a patient walks into my clinic, I will not say that, okay, this is anti-aging, so you do a Botox, you do a filler, and you're set. No, that is not how we approach it these days. There are cases where, even if you are, let's say, 50 plus, but you are not a filler candidate, someone who has a very bulky face, we will not do fillers for that person, because it will add more bulk. So we will probably do a treatment like HIFU, which is a ultrasound treatment, which causes thinning of the face, plus it causes lifting of the sagging skin. So we have that. We have radio frequency, or then we have threads. Okay, thread lift is again a very new and a very gratifying procedure, wherein we use absorbable threads. Okay, which give you an immediate lifting effect. So it is going to pull your skin like this up. Plus another advantage being that when the threads are introduced into the skin, they cause a lot of collagen remodeling and lot collagen stimulation. So they have an immediate lifting effect, and they have a long-term effect because of new collagen being formed. So every case is very different, like I said. All right. So we look at these treatments, plus we look at treatments to rejuvenate your skin, like lasers or peels, or now we also have newer treatments like something called as skin boosters. Right. So skin boosters are nothing but again hyaluronic acid, like fillers. The difference being the skin boosters hyaluronic acid is extremely lightweight, so it is not meant for giving you volume, or it is not meant to lift or give you, support. It is just meant to give you a lot of hydration. So when you inject it, the hyaluronic acid has the ability to absorb water. So it gives you hydration from within. So from within, you will feel that your skin is looking dewy, soft, right? It gives you a very nice glow. So a lot of younger people are opting for this, who are probably not the candidates, for fillers or for like 30 plus. Even we have brides and all coming and doing these treatments. These to a certain extent have a plumping effect on the skin. And then we have fillers which are a much more higher molecular weight hyaluronic acid, which is heavier, so it gives you that lifting effect to a certain extent, gives you the filling effect, and gives the support to the tissues. Right. So we have, like I said, now we have a huge variety of services to choose from. So each person deserves a very customized approach. So that is why when you go to a proper person, when you go to a dermatologist, all right, so a dermatologist will look at you from all angles. So I always say that aesthetics, when it comes to anti-aging, it is as much a doctor's job as an artist's job, right? So the face has to look rejuvenated without being obvious that you've done something. So we always say that the best injector is someone whose work cannot be detected, right? So that is why it is very important that you go to the right person who has a qualification and who has the experience of doing these treatments, so that it gives you a natural look and does not give you, that filled up faces and all. Again, one word of caution also that I would like to give my patients, I always give that follow your doctor's advice. A lot of times what happens is patients, so this happens, this is psychological. You're looking at yourself in the mirror every day, and sometimes you feel that the filler is reducing or one line is coming or something, which is fine. It is normal. It is a natural aging process. When you do overdo it, that is when it looks weird. So listen to your doctor. A lot of times I know doctors who say that no, don't do it, but then patients still insist that they want to get it done, and that is where the entire thing goes wrong. So I always tell my patients also that listen to your doctor when the doctor is saying a no, and follow your doctor's advice.
So, ma'am, now I'll ask you one of the most popular questions. What is the importance of skincare routine and the importance of sunscreen in anti-aging?
So, see, like I said, in clinic treatments are one thing, but you have to take care of your skin back home.
Yes.
Okay, it's like exercise. You have to do it every day to stay in shape. Same is the case with skin. All right. So your skincare routine is very important. I believe in a very minimal skincare routine. I don't give a lot of serums and a lot of creams because it's not practical. You require a good cleanser. All right. You require a good moisturizer, and you require a good sunscreen. These three are the main things. So a cleanser twice a day, a moisturizer typically at night if you have a normal or an oily skin, or if you have a very dry skin, then you use a moisturizer twice a day. And on top of that, during the daytime, you use a sunscreen. Sunscreen is extremely important because, like we spoke about in the anti-aging question, that your UV rays are the primary cause of accelerated photoaging. They cause pigmentation, melasma, and of course, not so much in India, but out of in the West, it is also a very common cause of skin cancer. So sunscreen is very, very important. If you don't want to use anything else, the one thing that you have to use is sunscreen. Sunscreen needs to be used anything SPF above 20 is fine. It has to be a broad spectrum sunscreen. What is more important is that you need to reuse it every 3 to 4 hours, because most of us don't know this, that the sunscreen effect is practically nil after 4 hours. And especially if you're going to be sweating, or if you're out on a holiday, or if you're in the pool, then the sunscreen gets washed off probably within an hour or two. So it is very important that you reapply your sunscreen. Okay. Of course, then when you are aging post 30s or post 40s, you can add serums like a retinol serum at night. You can add a vitamin C serum, but these are of course add-ons, and these again I would say that consult your dermatologist and then start using these products. But then these three, that is a cleanser, sunscreen, and a moisturizer, is extremely important.
So, ma'am, we have heard that Skinsure offers a lot of non-invasive fat loss therapies. Could you please tell us a bit about it?
So, so once we've done the skin treatments, we've now launched non-invasive fat loss therapies, because everyone, it's not just the skin, the entire package. I mean, you have to look good. Everyone wants to look good. So, we offer non-invasive, non-surgical treatments, namely something called as cryolipolysis.
Yes.
Then we have HIFU, we have injectable lipolysis. So all these treatments are basically for fat loss. They're for inch loss. They are not meant for weight loss at all. All right. So these treatments are not an alternative to a healthy lifestyle. You still have to follow a healthy diet, a balanced diet, and you still have to continue with your exercise regime. But these treatments are for those individuals who have stubborn fat pockets, or especially, women post pregnancy, post delivery, when you have that tummy, or some women have the saddle bag. So it is basically for these stubborn fat pockets which are not responding to any amount of diet or any amount of exercise. So these are the cases, that we do these treatments for. So cryolipolysis simply is called as fat freezing, where the fat is freezed, taken to minus 10 degrees, and there it is freezed at that temperature, and then it is slowly eliminated from the body. As against HIFU is the exact opposite, where the temperature is taken up to 70 degrees, and then the fat dies at that place. Plus, HIFU also has an added advantage of lifting sagging skin. A lot of people post pregnancy may not have fat but have sagging skin. So that is where HIFU comes into play. Then we also have injectable lipolysis, wherein we inject certain substances into the skin for small fat pockets, like a double chin. So which takes care of your double chin. So there are these different treatments are available, which people can use, which are, so like I said, they're not weight loss treatments. They're typically called as body contouring treatments. A lot of times they are single session treatments. All right. If at all we repeat it only after 3 months. It takes time. It takes about 2 to 3 months to give you results. And yes, the results are quite gratifying. And we also tell our clients and our patients that they have to follow a healthy lifestyle even when they are doing these treatments to give them optimum results.
So, ma'am, you are dedicated to your profession. So, along with your professional and personal life, how do you take care of your skin?
So, like I said, I follow my routine. I diligently use a sunscreen. That is one thing I never forget to use. Sunscreen, moisturizer, and a cleanser. And of course, whenever I get the time, I do some of my in-clinic treatments when I get the time. And at night, I have just started using a retinol serum. But like I said, sunscreen is something which I don't skip at all. And of course, it is very important to follow a healthy lifestyle, follow a healthy diet, because at the end of the day, what you eat is going to reflect on your skin. Right? So cut down sugar completely. Sugar is extremely bad for the skin. Cut down refined carbs, cut down fast food, colas, no smoking, no drinking. Include lots and lots of fresh vegetables, fresh fruits, nuts are very important, like almonds and walnuts. Right. So all this is going to help, and I always tell my patients, give it time. There is no like a quick remedy. We don't have a magic wand. Like exercise takes time. You have to diet. You want to lose weight. You want to maintain a fit body. You have to keep on it for years. It is not like you do it for 3 months and stop.
Yes, right.
Same is the case with skincare or hair care, or you have to. It is a lifelong journey. So you have to follow this healthy lifestyle so to maintain like a glowing skin.
Lastly, ma'am, any advice for our Pune mirror viewers?
So, like I always say, that I've always please visit the right person. Do not trust anyone with your skin. We have a lot of, quacks which are there. I have heard that salons are doing these treatments, right? There are other non-qualified people. So please, like you would never trust your heart with anyone but a cardiologist. Please don't trust your skin or your hair with anyone but a dermatologist, because you deserve the best. Normally, these treatments look very simple, but if something goes wrong, the consequences can be disastrous. All right, please do your study. Even whatever dermatologist you're visiting, ask your questions. Don't follow Instagram, or don't follow your DIYs, or don't follow influencers blindly, and keep it simple. I think just take care of your skin, logically, scientifically, and visit the right doctor, and I think you're sorted.
Well said, ma'am. Thank you so much for guiding us with your expertise.
Thank you for having me.